We'll get started. I'll introduce myself, then I'll have Lindsay introduce herself. So my name is Leah Pescaro. I work for Aspen. This is my dog, Izzy. She's a Yorkie. So I was a hygienist for 10 years, 5 years at a private practice, and 5 years at another corporation, another DSO. During COVID, I was furloughed for 2.5 months, and I was like, okay, now's my chance. Got a clinical because I kind of burnt myself out working a lot and a lot of Saturdays. I'm like, all right, I want to do something different. And I feel like in Chicago where I live, the master's degree is like keeping up with the Jones. So I went back to school and got my master's degree. It's in science of health communications, a very broad major because I really didn't know what I was going to do with it. Like you can do public health, you can do management. There's other different things you can do with it. So then I just applied for all these different roles. It took about 4 months to find this job. I actually heard horrible things about Aspen. A lot of my hygiene friends and students have told me like horrible things about Aspen. I'm like, well, why would I ever want to go to them? But there was one girl in my dental hygiene class who was the president, and she's with Aspen for 10 years. And I saw her Facebook posts and all this like fun stuff she's doing with Aspen. So I called her up and like, okay, why do I hear all these horrible things when you're posting all these fun things? And she told me the good, the bad, the ugly, which when I go to schools and do my presentations, I explain about too. And we can talk about this in this webinar as well. And so I'm like, all right, I'll give them a shot. So I applied for different roles with them, anywhere from an office manager role to operations to stuff, I didn't know what I was going to do besides, clinical hygiene. And then my boss found me on LinkedIn and she's like, let's do an interview. I'm like, all right, what's this interview for? Because I applied for 3 or 4 different roles with you guys. And she said it's for the academic team. I'm like, what's that? She's like, you go around the hygiene schools, talk about Aspen to the students. And like, I'm a support system for all the students out there. Even if you want to come work for us or not, like I give you my name, my number, my email, and you can contact me about anything, to resume writing, to interview skills, to any, like I have students contact me a year afterwards and it's like, hey, I'm interested in Aspen now, and I guide them to that right person. So anyway, that's my role, and I'm no longer in the op. I live in Chicago and I cover about 15 states, and I'm always flying everywhere and getting all the upgrades with my flight status. The perks about the job.
Yeah, that's nice.
Lindsay, do you want to talk about yourself?
Yeah, so my name is Lindsay Baldwin. I graduated hygiene school last May, so about a year ago. So I'm, still a little bit newer to the field as a hygienist. I started with Aspen in October, and I float around to all the different Buffalo offices, which I like. It's nice to work with different doctors, different people. But I've been working in healthcare for about 6 years because I have my dietetic degree as well. So I graduated with that degree in 2017. So I've been working in a nursing home with my dietetic license for about 6 years. So I love working with patients, love being in the healthcare field, love working with people. So yeah.
What school did you go to?
I went to Erie Community College in Buffalo.
Yep. Mm-hmm. I was at her lunch and learn 2 years ago.
Yes.
Now she's working with us.
Yep.
So I'm going to ask you all these cool questions. So why did you choose us? Like, what made you choose Aspen?
Well, a lot of things. So obviously money talks. You're always going to consider your hourly pay or what you're going to make when you're choosing your job. One of the good things about hygiene is really you're always going to make a good salary, and it's always going to be reliable wherever you go. But Aspen was able to offer higher hourly rates as compared to other offices that I was interviewing with. Sometimes you can even get, the sign-on bonus, the tuition reimbursement, which is huge. That was a huge decision in my decision making. Also, the PTO is good. The benefits are good. There were some offices that I was interviewing and they didn't give you any PTO at all. They said, you can take off whenever you want, but they didn't give any paid time off. So definitely those two things. I really liked the new patients, how they do the new patients. It really allows you to treat the patient properly, not undertreat or overtreat. So when I shadowed a hygienist, it was cool to see that. So those were like the biggest factors I think that made me go with Aspen.
Yeah, those are good for everyone too. Like when you're interviewing anywhere, you got to realize, what values you like. Is it the PTO? Is it, the paid time off? Is it the medical, vision, dental insurance? all those perks. Like some people don't need those perks because they have a husband or a spouse that have all those and they're just on their, spouse's account.
Right.
People like me, I'm a single girl in Chicago, so like I need and like all that.
Right.
Depends, on what you're looking for.
Yeah.
And, every office is different, Aspen or non-Aspen. You got to go in. I tell all my students to, go in, shadow, meet with the dentist, meet with the hygienist, make sure it's a good, fit personality wise, because they're all a little bit different.
Right.
So that's another big thing. And by the way, you guys can ask any questions too in the chat button. And I'll try to, read those while we're going on. And then if you guys have any questions at the end too, you can ask questions. All right. So tell us about your onboarding experience. How was it for you?
Very organized and easy. For the first couple of weeks, you are going to sit through a lot of classes, a lot of online classes on the computer. And then you also attend like live webinar classes with different companies who kind of educate you on the benefits of their things like Oral-B and or Pharma with Arrestin. So it is lengthy, like some of the things that you're sitting through, and you're kind of like, oh, I want to get out, and be with the patients, but it really does help you learn about Aspen, how they do things. So it was really beneficial and very organized, structured, very easy to go through the training. I was also able to train with a longtime hygienist, Brittany. She was amazing. It was really, really helpful on top of the online courses to see like how she ran things in the office, just wording how she handles situations when certain things come up. It was definitely really helpful to have that mentor as well as the training online too.
For sure. And then we had a question in the chat. How long is the onboarding process?
2 weeks.
Yeah. I always tell people, so if you need more time, raise your hand and let them know. So with Aspen, when you're a hygienist, you have a territory hygiene manager with you, which is Devin. You'll see Devin in this chat. So Devin she's no longer a hygienist anymore, like myself. So she actually goes in the offices. Unlike me, I go in the schools. She goes in the offices and she's like your mentor support system for you as a hygienist with Aspen.
Yep.
So she's in there maybe one day a week, every other week, one day a month, just depending on what you need and how busy things are and things like that. So that's your go-to person. Like if you have any, issues, you want to praise, complain, whatever as long as you raise your hand and talk to Devin, like your territory hygiene manager, he or she will get it done for you. And I always, if they're not doing their job, there's 7 people above them to, raise your hand and say something.
Right. Even just little things, you can always reach out to them. Like they're there for the support of the hygienists.
Right. Yeah. And like I said, if you need, like in that first week, how you were describing like a lot of the, onboarding with the virtual series things. And usually I think it's the second week where you're with a hygiene trainer and that person's basically holding your hand, like you're shadowing that hygiene trainer. So you know what it's like in a day-to-day office, and then you hop in as well and do, see patients too. So you know the flow of everything.
Yep.
We talked about mentorship, which is basically Devin. Like all the offices have a hygiene mentor. They're not your personal one, but they cover, how many offices do you cover, Devin, for example? She's driving, so sorry.
I have 28 offices, from Buffalo into Rochester, Syracuse, and the Southern Tier, all in New York.
Yeah, so she's in the New York territory, and like I said, covering 28. So she's not going to be at all of them all the time. Like usually her role is like a Monday through Thursday. She'll try to be in the offices, and then Friday is like her admin day. But yeah, you go to that, you go to her or him for anything.
Yep.
All right. Let's talk about the patient experience. How did you feel the patient experience was for you when you first started out?
Good. Usually the patients, they're always happy, after they leave. I think sometimes when you're going into, perio chart on a new patient and you kind of surprise them with you need the SRP, which, is the deep cleaning and the antibiotics and your gums are infected. And I think they're a little bit confused as to why they need that all of a sudden when they've just been getting regular cleanings or prophies in the past. So I would say sometimes, patients' reaction to that isn't always, a happy-go-lucky reaction. But if you really sit down to educate with them on why they need it, and you can show them the bone loss, our x-rays has like an option where you can actually use like a a ruler and basically show them that they're having that bone loss, and they really appreciate you taking the time to explain why they need that. And they're actually thankful that those numbers were taken, because we have, 50, 60-year-olds who are coming in, they're like, nope, never had those measurements taken my whole life. Um, so I think they're always happy after you're sitting there and explaining things.
Yeah, we're very thorough and by the book. Like, we follow AP guidelines, just like you guys learn in school. Our average patient is anywhere from like 45 to 65. They haven't been in a while or never been in. So we like really take the time and do a full comprehensive exam. Even if they're coming in for pain on like the upper left, like we're still going to address the pain, and we're still going to, address the hygiene and restorative. And that's, usually when the hygiene comes in and you do the perio charting. You explain to the patient what they need, and then we have a treatment coordinator that goes over all the costs with them, so you don't have to worry about talking about the money. Mm-hmm. What is the most rewarding about the role?
I would say definitely same kind of patient when they're a little bit shocked to see that that's the treatment they need, when they come in and they feel and see how much improvement their gums are after that SRP, or even when they come back for their perio maintenance 3 to 4 months later. I've heard patients say like how much better their teeth feel, their gums feel. Just knowing that you helped them achieve, a better health status is definitely probably the most rewarding. And, also like when they go home and they're changing their habits too, it's like you really made that effect on them.
For sure. All right, we have a couple questions in the chat. Is it 60-minute per patient for prophy and 90-minute for SRP? So there's no set times. You set your own schedule, how much time for a new patient. So there's no set times. You have your own autonomy to work your own schedule. When you're a new grad, if you need 60 minutes, 2 hours for a prophy, you can do that. But you are going to work with Devin or whoever your territory hygiene manager is to be, to work yourself to be more efficient. Mm-hmm. But even like, a year goes down the road, you're still in the back scheduling your own patients. I always tell students, like, if someone's a talker and you want to schedule them an hour 15, hour 30, go for it. If someone's quick and easy and doesn't like to talk, you can schedule them 45 minutes. So you can schedule whatever you want, whatever you think is comfortable.
Yeah.
How does Aspen move a hygienist from office to office, or can you stay at the same office? So that depends. If you want to be a float, you can float, and if there's an opening for that. Not all, like New York, I feel like in Buffalo, that's more common up there. My other 15 states I cover, it's not as common. So it just depends on the area and if there's an opening, and also if you're licensed in that state. Is there a non-compete policy? No, there's no non-compete. Same with the dentist. Like the dentist, they come and sign on. We do letters of agreement, and we ask for like a 90-day, resignation, and they can leave the next day. There's no unless you signed a sign-on bonus with us, and that just depends on each individual doctor with that Aspen of what they negotiated with you. Mm-hmm. So I just tell students too, if you want to work 10 hours a week, 40 hours a week, 30 hours a week, you're negotiating that with your dentist. So each individual Aspen is owned by a dentist. So you're negotiating with your dentist. What is the average amount of patients being hygiene treatment and new patient treatment planning? All right, you want to answer that, Lindsay?
What was the question?
What is the average amount of patients being hygiene treatment and new patient treatment planning?
So usually it's scheduled, you'll have your hygiene patient. We usually schedule on the hour, but like Leah said, if you need extra time at first, if you're still adjusting to, getting better at time management, you can always ask for longer. So usually it's one hygiene patient an hour and one new patient an hour. So you'll perio chart and you'll go in with a dental assistant and they'll help you put everything into the computer. You really just, are perio charting, calling out the numbers, and then we'll set the patient up, explain what treatment they need and why, and do the education. If you need longer for like SRP, you can ask for 2 hours at first. If you feel like you need even longer than that, then you can always ask for that. You just communicate with your office manager, communicate with your territory hygiene manager, and they can always help, adjust your schedule if you do need it. If you also go in and you're seeing a new patient and they haven't been to the dentist in 15, 20 years, they have super, super heavy calc everywhere, radiographically. you know it's going to take you a little bit longer than 1 hour per side, then you can just talk to your office manager, tell them, hey, this patient will need a little bit longer, maybe an hour and a half for each side.
Yeah. And then also another thing before I answer all these questions, when you're a hygienist with Aspen, like you have your own column. So you have your own column of your pro fees, your para maintenances, your SRPs, the recalls, and there's a second column, and that second column is new patients only. But you're not even, so the new patient column, the dental assistant is taking that new patient back, doing the FMX, doing the pano, doing the, what's it called, the scanning, and basically tapping you or putting a Post-it note on your, desk or whatever, say, hey, I'm ready for you to basically pause with your patient that you're currently with, just go and period chart and explain to the patient what they need, and then go back to your current, your column of your recalls.
Yep.
Okay, let's read these questions so we don't. What happens if it's before 90 days? Is there a fine? Is that for like the tuition reimbursement, things like that? It just depends if that's in your letter of agreement with your doctor or not. So they're all a little different. Just depends on what doctor is going to say yes or no to that. Unless you're talking about a dentist.
And there's usually a 90-day prior to you getting any of those anyway. So usually you have to be there for 90 days before it would even be valid. And then they're split up over periods of time. And if you leave prior to you getting, like, say it was 10,000 for a sign-on, you got 5,000 already, but you left before the second session of it, you just wouldn't get that remainder.
Right.
Right.
Does the tuition reimbursement apply for a hygienist that wants to continue for a bachelor's degree? Usually not. That just depends on your dentist. I know that, an assistant has been with an Aspen with this dentist for 10 years, and he's giving her money to go to hygiene school. So that's, that just depends on the dentist. We don't really do that. Even like for my job, like I was getting my master's degree and my boss even said, you don't need it for this role, but it's nice to get and have. So I'm going to continue doing it. That's just up to you, and it depends on the dentist too.
Leah, can I jump in on that one really quick?
Of course.
So the tuition reimbursement, it can be a little bit confusing. It does not have to go towards tuition. And I've had a lot of questions come up in interviews about that. It is used for anything that you want. It is not a third-party lender that would pay off any tuition expenses that you currently have. You can utilize that money in any way you see fit. So if you don't have any loans that you still have from school, you don't need to go back for anything, but you don't have to pay them off with that money. It is your money to do whichever you choose. So sometimes it's called tuition reimbursement. Sometimes it's called a retention bonus, but it does not need to be used towards tuition.
Mm-hmm.
Yeah. Okay, thank you, Devin. And then let's read this one. As a new grad, what would you say helped you become the most confident in educating patients? Leah mentioned the age range of current patients, and I worry that my knowledge will not be respected due to my age and the patient possibly preferring someone with more years of experience. That's a great question.
Yeah, so you're going to get the difficult patients that, might give you a little bit of pushback and stuff like that. Sometimes patients are like, oh, you look, a little bit young. How long have you been doing this? You know what I mean? And I say, like, our programs are hard and we have to go through a lot of classes and a lot of studying to get here. Like, I am newer, but I assure you, like, I know what I'm doing and talking about and stuff like that. But I would say, repetition, like after you start seeing more and more new patients, you're going to have like your spiel down. Like you're going to say the same thing to every new patient. Like if they need an SRP, I kind of start off with, do you know what periodontal disease is? Like, has anyone talked to you about it? And as time goes on, you're going to be more and more comfortable talking to the new patients and explaining what they need. And whatever hygienist that you're mentoring with, really try and focus on what they're saying and how they're saying things and how they're wording things, because you're really going to learn that from them initially when you're doing like your training.
Yeah, for sure. And then also, like, your doctor backs you up too. Like, you can't legally diagnose, you're going to recommend XYZ, and the doctor comes in to confirm and, backing you up on that stuff.
Yeah, the doctors that I work with are really great. They leave hygiene up to the hygienist, and if we say like this treatment is needed, they never question it. They totally leave it up to us. Like we definitely have our own autonomy when it comes to deciding the hygiene treatment for the patients.
Yeah. As in a joke around, like, I'm 5 foot tall, and after 10 years of hygiene, people still ask me, like, I
Yeah.
might be patient and I'm like, because I'm short. I know it. Like,
Yeah.
after 10 years, I still got that where people were like, but if you just have that confidence of like knowing your stuff and,
Yep.
you know, the more, like Lindsay said, the more like you practice with it, it's easier. It
Yeah.
will come.
And if you are unsure about what treatment you should be recommending for the patients, reach out to your hygiene support manager. Like they can try and get you in classes, or I know that Devin was offering like perio masters class to a bunch of the hygienists in Buffalo. So if you feel like, you know, you needed to be, you know, a little bit like your education need to be a little bit more spruced up and feel a little bit more confident in recommending treatment or assessing bone loss or things like that, there's always things that you can do to help.
Yeah. All right, the next question, I think it went along with the tuition reimbursement because it says, or dental assistants pursuing a hygiene degree. Same thing, like I said, like if the dentist wants to do that with you, then that's his or her decision, but usually it's not a very common one. All right, so we have to do assisted hygiene as hygienists at Aspen? No. So there's assistants, there's some offices that do assisting hygiene, but that just depends if the hygienist wants it / needs it, if they're that busy. But we have dental assistants that take back the new patient and do the x-rays and the scanning, where then you as the hygienist walks in and do the perio charting and education.
Yeah. They aren't like our assistants, I guess, as hygienists, but if you need anything, they're always like I travel to multiple offices in Buffalo, and every assistant that I've ever worked with is so amazing in helping the hygienist. If you need help with scanning a patient or taking x-rays, or if you're you know, running around and it's a little bit of a busier day, they go and clean your room for you. Like they really do help a lot.
Yeah, teamwork just
Yeah.
makes everyone happy. All right, here's another question. Are there any opportunities for hygiene students who have already graduated but does not have a license yet? So yes, it depends on your state and depends on things like that, but I always recommend you can come in and work as an assistant while you're waiting for your license, if that's an opportunity that's available. If you are interested in that, I can give you my name and number, or my number at the end of this, and you could text me of what location you're looking for, and then I would send you to that recruiter, and that recruiter would go from there. Yeah, that's what
some of the states allow you to work with a temporary license as well.
Yeah, I worked with a temporary license to start.
Yeah, New York can do that, but I don't think, I live in Illinois, Chicago, like I don't think we can do that. So each state's different.
Yeah.
But yeah.
Yep.
All right, thank you. All right, how long did it take you to adjust from an appointment at the hygiene school clinic to the flow of a normal hygiene appointment? That's a good question. That's on my
it took me a while. That's probably the one thing I struggled the most with was time management. So my temp license wasn't valid at a couple of the other offices. It was only valid at the one I was training at. So I ended up taking a little bit longer with my training because I wasn't staying on time. Brittany, the hygienist that was mentoring with me, she had to like step in and help me a couple of times. So it just depends on, you know, a variety of things, but you will get the speed up. You will get, you know, a pro fee, a perio maintenance, you will get it done in an hour. You know, feel like, oh my God, I had 3 hours to do all of this before, and how am I supposed to do it in 1 hour? But you will adjust. It took me about 4 weeks until I was like totally fine with staying on schedule, and then you're good to go.
That's impressive because when I was in hygiene school and I graduated in 2011, we did 4-hour cleanings at school, and then I didn't work as Aspen when I first started out, and I kind of wish I did because, you know, I didn't have all this mentorship and guidance and helping hand, so I was just kind of thrown in there. And I had my little note card with me because it was like, you know, in school it's like med history check, x-rays check, check. I had all my notes with me, and it probably took me a good year to get everything like, okay, I finally kind of know the flow. But it was like very hard my first year, even with like local anesthetic, even though yes, we learned it in school. I remember asking the hygienist, can you help numb my patient? Because like I was scared. Like I just felt like I didn't get like that good enough quote unquote experience in like the real world versus a school. You know, because you are taking your time with everything. It's just like you kind of jump in and it's like, whoa, you know.
Yep. I think for me too, like you're obviously gonna find what works for you, but a couple of things like I've done to, you know, improve time management is, sometimes if you see that you have like a couple of kids coming in, like a family, I set up 2 hygiene rooms and I'll kind of go back and forth. Or I do ask the dental assistants if they have a free moment to take x-rays for those patients. Or like I said, if you need the dental assistants to go in and scan one of your patients while you're going to perio chart another patient, like there's always things that you can, do to help time management. You can always team up with your office managers and anybody else, and they can always try and help you out as well.
Yeah. All right, there's a question. Are there free CE courses as an Aspen hygienist? Yes. So for example, in Illinois, I need 36 hours every 3 years. Half of them have to be online, have to be live, and all of them are free with Aspen, as long as you're an Aspen hygienist with us. All right. But as a new grad, you don't really have to worry about CEs until you're licensed, whatever state that is. All right. Is there a training course on light-based detection of oral cancer? My office is requiring this for every patient. However, my school did not require this in their curriculum. So we do an oral cancer screening. What do you use, Lindsay?
I use the Oral ID or the Velscope.
Yeah. So it's not required, it's recommended. We tell the patients we recommend and why we recommend it, and it's their choice if they want to do it or not. Is that how it is in your office?
Yep. So it's $30. So you would explain it's $30 out of pocket. Unfortunately, most insurances don't cover it. So you would explain that it is $30, and you kind of go through why it's needed or why we recommend it, especially if they're a smoker. That's definitely something you would want to encourage. And then if the patients are coming in as new patients and they say that they don't want it, it's something we always can offer later on. So when hygiene patients are coming in, we always offer it when they come in for their hygiene appointments as well.
Yeah, and there's also
sorry, go
ahead, Devin.
Yeah, I was going to say, I think if your office is requiring it and you're wanting some additional training, Forward Science is the company that is through Oral ID. So I would reach out to someone at Forward Science, contact them in any way you can to see if they can provide some training for you. But it's going to depend on what device your office is using.
Yeah. And any tool or technology or fun thing that we get, we also train you on it, and so you're comfortable before you even start doing it. We don't just say, hey, figure this out. All right, let me go to the next question. Thank you. At school, we had 2-hour appointments. Just med history took long for some patients. Yes. Oh, that's not bad, 2 hours. There's some schools I've been to where they have it's called, what do they call it? I don't know what they call it, but it's like a day in a life of a hygienist in the real world. So it's an actual hour hour cleaning. Okay. I guess yeah. I only a couple schools do that, but I'm like, oh, that's so nice. I wish my school did that. They only do it once or twice, at the end of the semester, but it's just nice to at least throw them in once to be all right, now I know what it's like.
Yeah, they called it Reality Day.
Yes, that's what it was. Thank you.
Oh yeah, I don't think I had that.
I didn't have that either.
That would be nice. That would be.
Yeah. All right. How do referrals work? Is the hygienist responsible for filling out those? Example, patients need a root canal. Does Aspen have endodontists? Depends on the area. So we have 2 specialists, endo and OS. They come in the office every other week or once a month, depending how busy it is. All the other perio, pedo, ortho, we refer out to that local area, our local, dentist our local doctor in that area. Do you write the referrals, Lindsay, or how does that handle in your office?
I do not. I have never written a referral. It's usually the office managers that write it with the dentist. Yeah. But no, I haven't had to fill one out myself. But it'll always be told to me oh, we're referring them for this or that, or we're referring them. But I haven't had to fill it out myself.
All right. Okay. All right, let's move on. Oh, there we go. Let's move on back to my questions. All right, so what advice would you give to hygiene students and new grads?
I think I kind of touched on this, but I would say just stay patient. You're not going to know everything. You're not going to know how to handle every situation your first, couple of weeks, especially if I wasn't a dental assistant. So going into hygiene after school is my first job, being in an office. And I've learned so much as I've gone. I think the first 3 or 4 months as a hygienist, you're going to absorb so much information and just kind of stick through it and know that, you're going to get there and you're going to become more confident in your decision making eventually. And always ask questions. If you're unsure about something, ask a question. There's so many people you can reach out to. Ask a question if you're unsure, and then going forward, you're going to feel more confident about that situation if it happens again.
Yeah, don't be afraid to raise your hand. That's what we have the support mentors for. What surprised you when you got to an office?
I would say how many scaling and root planings we treatment plan at Aspen. That was shocking because I think at a lot of other companies, they just treatment plan a prophy or give the patient a prophy even though they have bone loss, which is really under treating the patient. So I was shocked to see that when you are perio charting, how many patients are going to be treatment planned for the scaling and root planing. And I always tell patients not to knock another office or another hygienist because nobody's perfect, but these measurements should have really been taken, and you just have to explain to them and educate them, about why they need it. But I think that's definitely what surprised me the most. There's not too many prophies that come in. It's more like gingivitis cleanings and scaling and root planings, I would say.
Yeah, like I said, like our average patient is 45 to 65 and been in a while, so we're going to do the whole comprehensive plan for them so they know, all those little details. And it might take them 3 to 5 years to get it done, but like we're very big on the whole comprehensive thing.
Yeah.
Let's see. What did you wish you knew more about, I guess, before you joined Aspen?
What I knew more about.
What do you wish like school would have told you more?
So school, under my impression when I was in school, you need a scaling and root planing, and you have, the periodontitis and that category when you have a 6 or higher in probing depth. So when I got to Aspen, it's actually a 5, and sometimes even at a 4, you can see some bone loss starting to happen. So I think that's something that I learned from Aspen that school I think was a little off with. Yeah, I would say that's probably the biggest thing.
All right, we have a question. What are community service opportunities with Aspen like? So we do a day of service. The offices participate in it, and it's free dental work for all the vets out there. This year it's in June. I think it's on a Saturday or a Friday. And the dentist is doing free dental work for those vets, and the hygienist, you're volunteering and you're doing free cleanings for the vets out there. Mm-hmm. And then we also do, there is a overseas outreach program, and we go to different places like Guadalajara, Jamaica, Haiti, and it's 2 weeks. You're paid to go out there as well. And these are places who, patients have never even had dental work done before. So it's a huge, life-changing experience. I never got to go. I want to go, but I've never got to go because I'm not an Aspen hygienist right now and in the non-clinical role. And then we also have a TAG oral care center here in Chicago where I live. It's for Illinois residents only, and it is free dental work for people poverty level. So an individual that makes under 20K, it's free dental work for them. So how we do that is, for hygienists, you do the 2-week training program or the onboarding program. For the dentist, we now do 6 months with them. And during those 6 months, they come to Chicago for a month and they practice with implants, extractions, all that stuff at the TAG Oral Care Center in Chicago here. So they apply for their temporary license. They do free dental work for those patients, who are under the poverty level, which is cool because now they get all free dental work. How do we get more information about overseas outreach program? How long do we have to be with the company before we can? So it's usually you have to be with Aspen for 1 year. You apply, you interview, and they pick about 5 hygienists, 5 assistants, 5 dentists, 5 office managers. And yeah, that's how it goes. And I want to say it's usually 1 to 2 times a year they do the traveling. But yeah, you have to be with Aspen for a year, and then you interview and apply. Yep. All right, let's see. All right, my question, I don't know, mine's kind of questions are kind of repetitive. Like, did you feel prepared coming from school into an office?
Yeah, I felt very prepared. As our most hygiene programs they're hard, they're fast paced. I think in school they require you to, dot every I, cross every T, and even do so much extra work as compared to when you go out in the field. So I did feel prepared. And also, I think working in healthcare with my dietetic license did help me. I'm just, comfortable around patients, comfortable talking, educating, and working with, a team or things like that. So I definitely felt prepared. But if you get, to an office with Aspen and you feel uncomfortable or not prepared, like I said, there's so many people you can reach out to, so many people that can help and give you the resources that you need.
Yeah, hygiene school is hard. It was the worst 2 years of my life. Like, I got my master's degree, and I still think, don't be wrong, like, my master's degree was hard. It was a lot of reading, research, writing. The hygiene school was harder, I thought. Like, it was a tough boot camp of, dental. Like, it's a whole nother language you have to learn.
Yep.
I haven't done dental assisting before, and thank goodness I did, because, that first semester of, like, the terminology is just, like, a whole other language, like mesial, distal, buccal, like, all that stuff.
Yeah.
So yeah, it's definitely boot camp, but it's worth it at the end.
Mhm.
Like, it's tough love. I look back and I'm like, okay, I know the reason why, it was the way it was. But yeah,
Definitely.
it's like tough love.
Right.
We must be an employee with Aspen in order to attend. Yeah, the overseas outreach program. Yes. So yeah, it's only for Aspen employees. Correct. Career motivation, like any career motivation that you have, Lindsay, like, like with Aspen, you can be a hygienist forever, that's great. Or there's other career opportunities that offer out there. There's hygienists that no longer do hygiene anymore that are in marketing or recruiting or the academic team like I am, or Devin, who's a territory hygiene manager. Then there's a director above her that's, retired hygienist, quote unquote retired. Do you think there's any like career motivations for you or opportunities that you would like in the future, like in 5 years, 10 years, anything like that?
Not yet, I don't think. Right now I'm okay staying in clinical. I do think eventually being in clinical you can get a little bit burnt out. But I haven't really thought about any other opportunities in Aspen. I know there's so many, there's a bajillion, but I haven't for myself yet looked that far in advance, I guess.
That's good, because some students, like, they're like, I want your job. I'm like, I did my time.
Yeah. Right.
And honestly, I even tell like my hygiene friends, and like it took me like honestly a good 5 years to like do this stuff and actually eat, breathe, and sleep this stuff in my sleep, where I'm like, okay, now I know what I'm doing. Yes, it took me a year to get comfortable with patients and the flow, but it took me a good 5 years to be like, all right, I can do this in my sleep now.
Right. Right.
Okay, do you have to return back to school to hold any of the titles, or a BSDH to be enough? So what do you mean by that? So like there's hygiene, most hygiene schools are associate's degrees, which is a 2-year program. And I went back to school to finish up my bachelor's degree online. So I had the BSDH or whatever it is. Bachelor's in Science of Dental Hygiene. And then I got the master's degree. So if you're saying if you're asking if that's enough, so you don't need that. So my boss has her associate's degree and makes more money than I do. Like, she wasn't Aspen, like they usually hire people internally. I was a rare person who was hired externally. As long as she was with Aspen as a hygienist, she was a good employee, she raised her hand, she wanted to learn and grow, they trained her on that, and now look at her, now she's my boss, and she has her associate's degree. Like I said in the beginning, I had to get my master's degree because I felt like I had to keep up with the Jones in Chicago, and that's how I feel like I got lucky and got this job, but I'm a rare external hire. They usually want you to be internal.
I think my role, Leah, requires a bachelor's.
Oh, yours does?
Yeah.
Okay. Okay, let's see. So actually mine says bachelor's degree preferred, but when they interviewed me, they're like, it's preferred, it's not necessary. That's just for my role though. All right. What would you say has the most challenging and the most rewarding part about being a clinician thus far? And they're asking Lindsay.
Most challenging is definitely dealing with a difficult patient. They're adamant, they're saying they're not getting that, they're not getting the deep cleaning, or they've gotten the deep cleaning in the past and it was such an awful experience and it hurt so bad and they will never go through something like that again. especially when, you're busy with your own, day to day, and you really have to take that extra 5-7 minutes to sit there and reassure the patient and really talk to them about why it's so important that they get, the deep cleaning or SRP. That's definitely been the most challenging, because there's patients that will sit there and they'll argue with you, they'll give you a run for your money. So sometimes just having the patience of educating and trying to make them understand instead of, being argumentative back, that's probably the most challenging. Most rewarding is probably when you do deal with a patient like that, they accept the treatment, they come in for their SRP, and then they end up, being on perio maintenance, and they're so much happier with their mouths, their hygiene, they're taking better care of their teeth at home. That's definitely the most rewarding, is when you have that difficult patient and then they kind of come full circle.
Yeah, that's like that anywhere. At all my offices, private practice, my other corporation I worked for, same type of thing, where people are just don't understand it because, we're here to educate them. And then once we actually do the treatment on them and they feel the difference, it's like night and day, and they're like thanking you for it. It's like, yes, it's skills.
Yeah.
Yes. Another question, how many days did you work when you first started out at your job? You're asking, I can start, and then you, Lindsay, you go.
Okay.
I started out 5 days a week. And some Saturdays, like every other Saturday, just because, back in my day in 2011, it was hard to find a job. Now tables have turned. We're like, people are begging you guys more than the, the other way. So it was very hard for me to find a job. So, and I only wanted full time because I was a single girl by myself and I wanted full time with benefits. So I'm like, I'm going to work full time. I wanted it all. So that's what I did. What did you start out? How many days a week do you start out, Lindsay? How many days a week?
I started out at 4 days, and I'm still at 4 days with Aspen. I still work at my other job at the nursing home on Mondays. So I work at Aspen Tuesdays through Friday, and I think it works out really well.
Yeah, that's nice. Little mix-ups.
So far, yeah.
All right. I would love for you to also answer as well, Leah and Devin. Oh, what was your question? Let me go back here. Oh, the most challenging about our jobs. Challenging for me is challenging, rewarding. Challenging for me is, so my job is to go into the dental hygiene schools and talk about Aspen to students. And I always tell them, if you want to come work for us, great. If not, no big deal. My challenge is dealing with instructors. Instructors are, most of them are kind of old school, like anti-corporations, anti-DSOs, which I totally get and understand. My aunt, I always tell the story, my aunt's a pharmacist and she's only worked for a mom and pop shop her whole life. Unfortunately, he sold his practice and now she has to work for a CVS and Walgreens. And that's kind of how the dental world is changing too, because dental students, they graduate school, they're in $500,000 in debt. It's hard for them to keep up, to buy their own practice, to pay off their debt, to actually have a living, to be a dentist. With us, it's like, the dentist walks in, unless they want to be an owner or not, there's associates levels where they can walk in, kind of clock in, worry about their patients and go home. That's what I wanted to do as a hygienist. I didn't want to own my own business as a dentist because I saw how much blood, sweat, and tears go into all of it because my parents own their own business. And I'm like, you know what? I just want to be a hygienist. I have to clock in, worry about my patients, and go home. So the Aspen is a similar aspect of that, where the dentist can basically clock in, focus on patients, and go home. Then there's the owner doctors who, like, they pay us a business service fee to the hiring, the firing, the training, the whole 9 yards. So the dentist can just focus on the patients. So that's kind of like the world is coming to, because it's hard to keep up with everything and the times and the money and everything. So I feel like until those instructors understand that, and when I go to these schools, I'm not saying Aspen's for everyone, because I know, it's not all rainbows and butterflies. Like I said, they're all a little different depending on the owner and things like that. But it's just nice to know your options. So like when I give you all these, what we offer, so when you're interviewing at other places, what you like or what you want and need and things like that. So it's just nice to know options out there. That's the most challenging. The most rewarding is going around and traveling and meeting with students. Like, I love the face-to-face interaction. Like the Zoom thing, I'm like, I'd rather be in person. It's way more fun, but this is great too. But I love the interaction of being in front of people. I've met friends with Aspen, like Devin is now my friend, and I've met her with Aspen. Like, it's just like so cool to like meet all these people who are even like hygienists and non-hygienists that, we all work for the same umbrella, and it's, cool to make friends that way. Devin, what about your challenges and rewards?
So I think for me, the biggest thing I had coming into this role was going to be changing the mindset of some of these hygienists that have been with our company for 20 some years. I have quite a few in my territory that are longstanding hygienists with us. And I was informed when I started that uh, they weren't going to do things any different than the way that they were doing them. They want to do things, everything is old school. They're not going to try anything new. And all of these new technologies that we've had, they're not going to give them a go. And so I think breaking down some of those barriers was one of the challenges that I've had coming in. And the most rewarding is to see that now, even though they said that they wouldn't do them, I have now gotten majority of them to change their ways and try new technology and see that it makes their life that much easier. And they actually appreciate that someone has come in and talked to them about it, because I think everyone thought because they had been a hygienist for 20 years that they don't need any help, that they know what they're doing, that they've done things this way for a reason. And some of them have said, well, no one's ever come in and told me to do it this way. No one's ever showed me how to do this. Everyone just assumes that because I've been here for so long that I know everything already. But if no one ever comes in and tells me, how will I ever know? So I think for me, they've been extremely appreciative that they've gotten some help and support that they haven't had before. And they're truly grateful to have me around. And I think that it's been extremely rewarding for me.
All right. The next thing is I get an hour for patients, new or recall, right out of school. Do you have any advice?
Well, so you have an hour
For so new patients and recalls.
So
I your dentist about that.
I haven't had to do like new patients at Aspen. The dental assistants kind of take care of that column. So me personally, I haven't had to do like a new patient from start to finish in an hour. As far as hygiene appointments for an hour, I feel that's enough time for me at least to get through perio maintenance, prophies. Sometimes if you bump into the next appointment a little bit because they were due for an exam or x-rays or whatever the case may be, it always ends up working out that you stay on schedule. Say you had a perio maintenance and you had a perio chart and take x-rays and do an exam, but it kind of went like maybe like 10 minutes into the next appointment, but that was a prophy. So that was a little bit maybe of a quicker appointment. It always ends up working out. As far as new patients in an hour with them, Aspen really has the dental assistants kind of take the new patients and you're just going into perio chart and kind of explain to them what hygiene treatment they need.
Yeah, if you're feeling like that's too little for you, I'm assuming, like I would talk to your dentist and tell them how, you're uncomfortable. Maybe you need like an hour and a half for new patients or, whatever you think you need is best. I would talk to them about that. All right. Is 4 days considered full time? Is it 30 hours, Devin, or is it 32? I always get that confused.
I usually get it confused too. I thought it was somewhere around like 30, 35, 36-ish. I thought was around.
I think it's 30.
Is it 30?
30.
Yeah.
Okay.
And then they cut it to 32.
Mm-hmm.
Yeah. For hygiene, it's different. So yeah, I think it's like 30 or 32 now is considered full time.
Mm-hmm.
So 4 days, that depends because Fridays are half days usually. So we have like a template, like we would like to do like a 9 to 5 Monday through Thursday. And then we do like a later day, 1 day a week. So you come in later and you leave later, like you come in at 10 a.m., leave at 7 or whatever it is. And then Fridays are usually half days and Saturdays are half days, 1 day a month. So that's what we recommend. But the dentist, like I said, they own the practice. They have the ultimate say so of what they want to do. So some Fridays are a 9 to 3, some they may have 2 later days. So it depends on the hours and like some, you could probably work maybe 3 days and get full time. I don't know. It just depends on the office and what their hours are available to you to consider full time at 30 or 32. All right. Thank you to you both. Can I temp at other private practice offices while working at Aspen? Yes. Because even like endodontists do that. I know we have endodontists because, they're only with us 2 days a month and they work at other offices and, do their work. So you can do that with us too if you want to work part-time with us. and then part-time in another office, that's totally fine. All right. What are the pros for working with Aspen being corporate that outweigh the cons that are commonly associated with working in a corporate office? Pros? You want to start, Lindsay?
Yeah, so I was so turned off by working for like a corporation when I was in school. I was like, I'm definitely going to work at like a private owned office. Like I want small office vibes. Like I like being close with my coworkers. You spend more time with your coworkers than you do with your own friends and family. So you want that like family feeling when you go to work. So I was so turned off by like working for any company, but actually each Aspen's office is very small. So there's usually like one dentist, one hygienist, a couple dental assistants, and like the front office staff, and maybe like lab tech. So it's not like I interviewed with another company, and I think they had like 17 hygienists at once sometimes, and that was just insane to me. So Aspen really does have that like small office, like family feeling. Like every office really is really close with each other. It's not, even though Aspen's a big company, each office is very like small and has, you know, probably like 12 employees or less.
Yeah. All right. Are there any tips for ergonomics and longevity of practice? My loops are my best friend. That's good. I'm 5'8" and I find myself standing up to clean teeth most days. When do I sit? I prefer the saddle stool. So good you're wearing your loops, because I got loops in hygiene school and I didn't wear them until like 5 years later, because I was scared. And in hygiene school, it wasn't a requirement for loops. Like they gave it to us an option at the end of graduation. So when you're going through school and you have a new job, it's like, I don't want to learn like this routine with, you know, a 4-hour clean to a 1-hour clean and loops. So 5 years later, I finally got the loops out and I was like, wow, I feel like I should have wore these since day one. And I actually stand up to do cleaning sometimes because I feel like it's a lot of like pressure on your back. So it's a nice like mix. When do I say I prefer a saddle stool? So yeah, if you want that in your office, you can get that. Like, what do you use, Lindsay? Do you use loops? You saddle stool? What do you do?
I have loops and I haven't used them yet. I got them when I was in school, but I'm not used to them. So it's like the same situation. I have them, but I don't use them yet. A couple of different offices have the saddle stools. I don't like them, but I know a couple hygienists that do. So I think it's just whatever your preference is. I just sit in like the regular chair, and then sometimes I stand as well if I can see a little bit better. Sometimes I stand. So it just depends.
Yeah. Busy. Okay, let's see. Okay. Do hygienists get lunch breaks, and are they paid, or do you need to clock out? That's a good question for you.
You do clock out for your lunch, but yeah, we get in Buffalo, our offices are an hour lunch break per day.
All right, so we have like 5 minutes left. Does anyone have any other questions? Any comments, any concerns? I'm gonna put my name and number in here in case you guys want to reach out to me about anything. This is my cell phone number. My friends have this number. Everyone has this number. And I'll give you guys my email address too. And then, I don't know, Devin or Lindsay, you want to put your information in there too?
Sure.
Yeah, I'll put mine in there.
Okay. Make sure I spell. Okay, good. Yeah, of course. Thanks you guys for participating with us and asking good questions. And like I said, after this, I will draw the winner of the Lululemon gift card and I will text you and I'll email it to you. We have one question about, I'm unsure about tuition reimbursement. At what point does it happen? So it depends on the office if they are offering that or not. Not a lot of offices offer it. Some do. And if they are, they would tell you and go from there. Does that make sense?
I would say majority of the offices like in my area that have offered the tuition reimbursement, usually it's over a 3-year period, and depending on how much it is. So let's say, for example, it was 25,000, they would split that up by 3, and then each year you would get that amount every year, and it's usually on like around your year anniversary. So if you started June 1st, June 1st of 2024, you would get your first installment And then each year after that is generally how majority of the practice owners will work it.
Thank you, Devin. All right, any other questions for us? You guys got it. I know, like I said, we said school's the hardest 2 years of your life. Now you're waiting on your license. You'll get out there and you'll look back a year from now and be like, oh my gosh, okay, now I can do this. And I can't believe I was like worried about this.
Yeah.
Hopefully get my license in June. Cool. Yep. Yeah, I want to say in Illinois, I passed my boards in May and I didn't get my license till July. Illinois took forever. So you're lucky if yours in June.
Yeah.
All right, cool. Well, thank you guys for joining. And if you guys have any questions for Devin, Lindsay, and I, you guys have our emails, names, and numbers, and you can reach out to us about anything. That's what we're here for. All right, well, have a good week and happy Memorial Day weekend coming up, even though it's Monday. Thank you, Lindsay. Thank you, Devin.
Bye.
Bye.
Yeah, thanks, guys.